Do you suffer from lower back pain? Having suffered an injury myself, in this video I'm going to show you something simple that can give noticed relief and promote healing, which led me to devise something even more effective. Before we start, a quick reminder for you to hit subscribe so I can keep making interesting content. Lifting and loading. Carrying boxed items and heavy goods. Moving furniture. At work and at home, our lifestyles involve physical labour. But you don't have to be mixing and moving cement to end up with back pain. Nowadays, we find ourselves increasingly sat working at a computer, which is far from optimal. That and weakened core muscles could render you vulnerable to pain, discomfort, or worse. A sedentary lifestyle of 40 hours per week can be a tremendous health risk, and can lead to serious health conditions such as diabetes, obesity, and heart disease. Most experts recommend sitting for less than 3 or 4 hours per day. The optimal stand-sit ratio recommended by many experts varies between 1:1 and 3:1. At the low end, this means if you stood for 30 minutes, you could sit for 30 minutes. And at the ideal end, if you stand for 90 minutes, you can have 30 minutes of sedentary time. In 2020, globally, 619 million people were affected by lower back pain. That's 10% of the world's population. The number is expected to increase to 843 million by 2050. Lower back pain is the leading cause of disability worldwide. In the United States, for example, it's the 6th most costly condition, with healthcare costs and indirect costs exceeding $12 billion per year. The most prevalent cause of back pain by far is muscular strain and spasm due to ischemia, which means lack of blood. Without adequate blood flow to provide nutrients and oxygen, soft tissues such as muscles, tendons, and ligaments build up lactic acid and other toxins and become painful. This can also contribute to disc degeneration. Other causes of lower back pain include trigger points, nerve compression and nerve entrapment, structural imbalance or postural distortion, and dysfunctional biomechanics. Although back pain can affect people of all ages, the prevalence increases with age. For example, the first back pain symptoms arise between the ages of 30 and 50. The highest number of cases occurs between 50 and 55 years of age, with women more likely to experience lower back pain than men. Physical therapy is both essential and very effective, but there is only so much you can do or have time for. Sleeping on your back with a pillow under your knees may help relax your back muscles and maintain the curve of your lower back. Supporting your neck with a pillow should keep your neck in alignment with your chest and back. For additional support, you can try a small roll towel under your waist. If you sleep on your side, draw your knees up slightly and put a pillow between your legs. This will help align your spine, pelvis, and hips, and will take pressure off your spine. Here's my story. After carrying heavy loads again and again and again over multiple days, I ended up with a bulging lower lumbar disc. The largest nerve in the human body, the sciatic nerve, runs down through the buttocks and leg to the foot. The bulging L5-S1 disc put pressure on my sciatic nerve, causing extreme pain. As if that wasn't bad enough, a few months later, I misplaced my footing and fell. With the impact, the outer shell of the already pinched L5-S1 disc burst, causing the nucleus pulposus, or jelly-like center of the disc, to extrude into my spinal canal and against my sciatic nerve. The pain was excruciating. Most medical professionals advised surgery. Although surgery might have been the most expeditious route to pain reduction, some experts consider the potentially unnecessary and invasive solution archaic, much like trepanning to treat a headache. The body is self-healing. With surgery, although the percentage is small, there is still risk and the possibility of complications. Expert opinion is that only the top 10% of cases require surgery. The pain alone, though severe, didn't necessarily put me in that group. After conducting various tests, my neurological specialist concurred. According to recently published studies, usually a herniated disc will cure over time, and that extrusions are gradually broken down and absorbed. Test cases showed that without surgery, 90% of patients improved within 6 weeks. Another study found that using conservative treatments such as physical therapy was associated with pain reduction and a higher rate of improvement. The greater the injury, the longer the healing process. In most cases, after 24 months, even large extrusions were reduced by 2/3 in size. Blood flow in the lower lumbar region is poor, and the supply of nutrients and oxygen is minimal. Heat therapy has been proven to reduce pain and increase blood flow to promote healing. Rather than continually taking pain medication, physical therapy and heat therapy are methods I use and stand by. A hot water bottle, though effective, can be large and cumbersome, even when wrapped in a soft cozy. They can also be prone to leaking. Thermal heat wraps and patches provide targeted therapeutic heat. They relieve pain and accelerate healing, but they generally last only a few hours once activated, and are for one-time use only. Even so, using the heat wrap gave me an idea. This is a heated sleep mask I had lying around. Inside the soft washable cover is a USB-powered heat pad. The small of the back is sensitive. As such, I wrap the heat pad in a dishcloth to both soften and spread the heat. I used a tea towel to fix the heat pad to a used thermal wrap. The tea towel helps hold and spread the heat further. This was so effective that I decided to create something even better. Adjustable magnetic therapy support belts are cheap and easy to buy online. Although they are termed self-heating, my intention was to improve its effect. USB-powered heat pads are also cheap and easy to find online. To hold the heat pad in place against the belt, I made a soft washable cover. You could also use the sleeve of an old jumper or a sweatshirt. Again, to further spread the heat, you could wrap the heat pad in a dishcloth or tea towel. Previously, there were only two options: full power or off. Adjustable USB remotes with temperature control and timer control are also cheap and easy to find online. This type has 3 temperature settings: low, medium, and high, ranging from approximately 40 to 50 degrees Celsius. The 3 timer settings are 30, 45, and 60 minutes. This type has 5 temperature settings, ranging from 36 to 50 degrees Celsius, and 5 timer settings ranging from 20 to 60 minutes. With mine, although the instructions were in a different language, the controller was both easy to use and very effective. The temperature settings were the same, 36 to 50 degrees Celsius, and the 5 timer settings were 15, 30, 45, 60, and 90 minutes. I set up a thermal camera in order to gauge the effectiveness of the USB heated pad. The camera is at a fixed distance from the heated pad. Once plugged in, the heat pad gradually gets warmer. Through the thermal camera, we can see that the heat signature is fairly localized. With the heat pad wrapped in a dishcloth, I ran the same test again. The thermal camera shows that the heat is more spread out. In this side-by-side comparison, we can more clearly see the difference between the 2 heat signatures. Here, we can see the thermal signature with the heat pad wrapped in a dishcloth and within the homemade sleeve on the belt. The final product, which cost me less than €10, is both discreet and very effective. I found the belt itself adds support and helps maintain the curve of my spine. It can be worn both during the day and while sleeping to promote circulation and healing. In fact, I use mine every night. Moreover, since it can be powered by a USB power pack, it can be worn at any time, including while out and about. My honest opinion? It really helps. and I have noticed improvements. Thanks for watching. I hope you liked this video and found it helpful. Don't forget to subscribe, hit the notification bell, and check out the other videos on my channel.